Stroke alert to the emergency room stat.
Med 2 went on a health and care report.
Helping others is my goal in life since I was little.
Well, I started out in the hospital setting, and I worked in the ER here at Winona Health, and then I took the EMT class at Winona Ambulance, and then I joined shortly after that.
We see people at the worst day of their life, whether it be a simple fall, cardiac arrest, a car accident, and have that ability to help them in their time of need is the biggest thing that you can do.
So we see any age, so from newborns up until 90s, 100-year-old patients. There's always somebody here ready to kind of take care of anybody in the community.
We can go from having one patient in the emergency department to getting 3 to 4 or 5 plus ambulances and having people come in through the front door. Instead of IV teams, our nurses and technicians do start our IVs. We have our own catheter care, med administration. I think especially in our smaller community, having available health care 24/7 is so important to our community to keep their family members here in town and close to home. Time is of the essence when it comes to emergency medicine and care, and I feel like we do really big, important things here.
My mom was a nurse, and I knew I wanted medical, and when I researched different medical professions, imaging was the best fit for me. We are constantly on the top of our innovation, always giving good quality exams to our patients. There's always room for advancement. There's so many different things you can do. It's a great occupation to get into.
As a surgical first assist, you are considered, a second surgeon basically. You are a second set of hands for them, you're a second set of eyes for them. So that way, if something is going on outside of what they're focused on, you can bring it to their attention. I love that every day is something different. No two cases are the same. Definitely consider this career field if you are detail-oriented, if you care about people and their well-beings and want to help make a difference in their life.
We help people when they're feeling that they cannot breathe or can't catch their breath, and we provide either medications or equipment that helps them breathe easier to reduce that anxiety. We do high flow, we do CPAP, BiPAP, which is a non-invasive ventilator, and if it's really emergent, we have actual ventilators that we maintain. In the ER, I help transfer them up to the floor. I then see them for pretty much their entire stay, start to finish. I continue to do what I do just because I firmly believe that community hospitals are important to an area, and if I can help and be part of that community, that's what I want to do.
I love working in the ICU because we really get to do one-on-one care with patients. We see a handful of different patient populations. We have a lot of surgical patients. We have a really good surgical team here. We help people with respiratory needs, if they need a lot of oxygen. People who are going through sepsis, who have bacterial infections in their blood. We help with that, help stabilize them. But I just love the camaraderie here and how caring everyone is for their patients.